everyone, and welcome to another insightful episode of MedSynapse podcast series. I'm Hitvisha, your host, and today we're diving into an incredibly fascinating and timely topic: the role of meditation in reversing chronic lifestyle disorders. And to discuss this, we are honored to have with us Dr. Rahul Kackar, a renowned diabetologist and diabetes reversal expert who has been at the forefront of integrating meditation and holistic practices into modern medicine. And with over 2 decades of experience, Dr. Rahul is a pioneer in personalized precision medicine, blending Tai Chi meditation and nutritional therapies to combat chronic disorders. His expertise goes beyond clinical practice. His expertise goes beyond clinical practice as he is also a sought after public speaker and advocate for holistic health. So, welcome, Dr. Rahul. It is a pleasure to have you here.
Thank you, Adrian. Thank you so much. It's a delight to be on this platform and to share the knowledge.
So, to kick things off, could you share a bit about your professional journey and what led you to explore the intersection of meditation and chronic lifestyle disorders?
Yeah, so I have been in the healthcare practices since last 22 years. And initially, the primary part of around 15 years, 10 to 15 years, I was mainly focused as an internal medicine specialist, looking after the critical care and the chronic disorders like heart diseases, all the non-interventional part of various allied sciences I was looking after. Then subsequently, what brought me into this was that I was into the field of meditation since last 15 years. And there, as I was progressing in that art of meditation and healthcare is too much interlinked, because meditation is something that is related to your mental well-being, emotional well-being. So from there, when I started looking into what are the links that are there between the mental well-being, meditation, and also the physical ailments for which we were only having the bandage approaches of giving medications for long periods of time, and then the course of the chronic illnesses was generally of a remitting and relaxing nature. But there was no definite cure for chronic ailments. So that brought me to explore whether there is any science that is integrating meditation into the chronic disorders. So from there, I landed into functional medicine and I started studying about the functional medicine. I did various courses in anti-aging medicine, longevity, functional medicine. So that's how the core practices of healthcare from the conventional medicine shifted towards a holistic well-being approach, which was integrating meditation along with the conventional practices.
Yes, that was very insightful, and your journey is truly inspiring. Now, moving on, can you explain how meditation influences the body's physiological processes, particularly those related to stress, inflammation, and chronic disease?
Yeah. So we were basically looking into the basic framework of human being. We know that there is a physical form, there are internal organs. That is one part. Then there is the mental and emotional realms, that is the thoughts and the emotions, the feelings that are there. And then behind that, we know that there is something deeper, what we call life, that is there, the life force, the consciousness, the attention that is there. So this attention is something that is flowing in different realms. Whenever we are doing something, that means that our attention is called to that action and we are totally absorbed and we are doing that. Similarly, in the mental, the attention gets absorbed there and we are not aware about the attention, we are totally into those thought processes or the emotions that are. So this is one part that is there. Now you can say that this is the human dimension. Then that consciousness or that being dimension that is there, connecting into that being dimension is meditation. Right? So this is one thing. Now we see that whenever there is a disease in any form, either a physical disease or a mental, emotional, whatever it is, our first approach is that we ask the patients to get some lab tests done, right? So that means that there is from the form dimension, there is a molecular level, or you can say the level of neurotransmitters, chemical messengers, hormones that interplay into getting a disease that is manifested or the health or well-being that is manifested. Right? So this is the one you can say for any problem in the physical, we subject the patients to the lab tests, pathologies, and all these things to understand what is happening on the microscope. Now we know that whenever there is a strong emotion, mental feelings that are there, or thought patterns that are there, these things can alter the neurochemical messengers or the neurohumoral systems. They can alter the hormones, everything. So that means, seeing the chronology, we see that for the physical, we were looking into a subtler part that was the microscopic level, and there is something deeper there that we can't assess on a laboratory through the laboratories, for which we are using various scales, or in the psychology we are using various questionnaires to understand what is the mental and emotional problems, and we see that those things are altering this molecular or the neurotransmitters, hormones. Now, what is there? What is the thing that is altering the mental and the emotional aspect? Altering the mental and emotional aspect means, if the mental and emotional aspect is not bringing happiness, if there is suffering because of the mental and the mental and the emotional aspect, then that means that it would be subsequently transmitted into the neurochemical levels, and that would be subsequently transmitted into the physical level to manifest as disease. So this mental and emotional level means it is determined by what is your current relationship with the present moment. That is, what does that mean? Whatever there, what is in front of you, are you in the acceptance mode or you are in a non-acceptance mode? So what happens whenever you are in a non-acceptance mode means that you are in a threat. If you are in an acceptance mode, you can only be in an acceptance mode if you don't feel any threat in the particular situation in the now. If you take the now as a threatful thing, if your relation with the present moment is a threatful thing, that means your thinking, thought processes would be shifted by the limbic system. That means the primitive brain. So the primitive brain that is there, which includes the amygdala and the basic circuitry. So the response that happens through the primitive brain is fight or flight response. So fight and flight response means that there is a threat and you have to act in one of the two levels. Ways, either you fight or you flight. So taking it to the emotional and mental level, what is meant by fight and flight? Fight and flight means either you hate, that's why you are fighting, or you are fearful. So you want to run away from the situation. So these are the dominant emotions in which the human being is there in 24 hours of the day. Now, what will happen is, to maintain this, a similar set of neurotransmitters would be secreted in the body that would be preparing the system to either run away or to fight. But you are on the physical level, you are neither running away nor you are fighting. So those things that are building up are the mainstay that is leading to chronic illnesses. That you call the stress response. Anything that is a threat is a stress response. All right. So this is one aspect that we look into, that how this is happening. Now, this thing is reflecting into various areas. This hormones that are noradrenaline, adrenaline that are secreting, then the cortisol response that is happening as a stress response. All these things are the manifestation of this basic problem. What is your current relation, the moment that is happening, and aligning yourself with the present moment, not taking the situation that is there as a threat and going into acceptance is meditation. You can take it in a different word. Because the moment you align yourself with the now, you are aligning yourself with the life consciousness itself. That is something what we discussed previously, that meditation means. And the moment this happens, you are aligned, your functioning shifts from the limbic or this primitive brain to the prefrontal cortex. And the moment it shifts there, the first signal is to stop the firing of the limbic system. To stop the firing of the limbic system, and this way of functioning, this meditative state is bringing up a different set of chemical messengers, hormones in the system. Your serotonin levels will go up. Then there are various endocannabinoid systems. That means cannabis. The cannabinoids means that the thing which acts on the cannabis receptor, which is secreted in the body. So one of the endocannabinoid is anandamide. Anandamide is getting the name. Ananda means bliss, and amide means a peptide. So it is a peptide that is secreted. So once you are into meditation, all these things start changing, and the disease and the suffering is converted into joy, happiness, well-being, peace that you start experience. So this is, now this we say that this is the root cause that is producing well-being. Why this is the main thing that is happening in all the chronic ailments? We see that if we talk about any lifestyle modification, like doing a regular exercise, eating a healthy diet, controlling your depression, anxiety, having a good mood, indulging into various forms of laughter, social connections, all these things are not only helping in heart disease, not only helping in diabetes, not only helping in cancer, depression, anxiety, but they are helping in all the chronic disorders. If one thing that is helping in all the chronic disorders, that means that the common problem must be different that is acting in all the things. All right. So suppose we say that this is an immunological problem, this is a malignant problem, this is a chronic inflammatory problem, this is the very infective chronic infection is there. Now, looking into the framework, this means that whatever we are doing, we are evaluating all this in the microscopic level, giving the medications and only being concerned with changing the neurotransmitters and chemical messengers without taking into consideration this link. This thing will not happen. This thing will not happen. That's why if something is working, it should work in all the conditions. That is the thing, whether it's a causal relationship or not. If there is a cause, there is an effect. If you remove the cause, the effect should also go. So they say that they don't find a causal relationship for anything in the conventional system. Why? Because there are multiple factors that are happening there. So that's why they are saying that they are only risk factors. They are not causal relationships that is happening there, because it is working on multiple levels and we don't know what is the mental, physical, what is the state of your relationship with the present moment. So this is, I think I've given a brief overview. If that helps you, maybe we can take further.
It was very interesting. Now, how meditation can be effectively combined with other treatments such as medications, diets, and exercise to enhance overall patient outcomes in chronic disease management?
All right. So we have seen that meditation is something that means aligning with life or aligning in the now. So this consciousness or this attention is something for which you are relying for each and everything, for every functioning of your system. If you are saying that your diet is not right, rather than going ahead and imposing something on yourself, stopping all the junk food, stopping all the carbonated drinks, going for a bowl of fruits, salads, vegetables, imposing this thing is one way of dealing and seeing the problem. The second thing is aligning your, because a decision what you want to eat is coming from the consciousness. The moment you align your consciousness, meditation will empower you to see what is good and what is bad for you. So it will help you to make healthier choices for yourself. So this most of the thing we see that the pathological eating patterns like binging, all these things are a escape response to either loneliness, to maybe nervousness, some of the mental problems that the patient is facing. So most of the times they are not aware what they are eating. Leave apart whether they are aware what is healthy for them and what is not healthy. So meditation will declutter the consciousness and make the person more aware in the now. And once he is more aware there in the now, whatever choices he will be making, those choices would be something that will be empowering him. Rather than going on one step, what to eat, how to walk, when to walk, how to sit, how to do that, just align with the now, just the meditation, and whatever is coming will be dealt in a more intelligent way.
Yes, that makes a lot of sense. And I think it also depends on how personalized it is. Like, how is your body taking it, and how it affects your body. Now, what metrics or tools can be used to measure the effectiveness of meditation interventions in patients with chronic lifestyle disorders?
All right. So first is we can always take into consideration the basic problem that the patient is coming for, like whether it is for the diabetic management, whether it is for cardiac ailment, hypertension, whatever the reason is. First is that we can see that after the repeated meditation practices, whether the patient is having a more better glycemic control, what are the changes in the habits that the patient is over the period of say 3 or 4 months of meditation practices, whether the patient is more empowered to choose a healthier lifestyle and those practices that improve the outcomes. That is next. Then it has been shown that at least 3 months or so of meditation practices improves the blood sugar control, improves the hypertension. It is beneficial for osteoporosis, reduces the risk of cancer also. So all these things have been documented. Generally for cancer reduction, it is mainly for a prostate cancer, breast cancer, and ovarian cancers that meditation has helped the patients.
Yes, those are some good tools to be known, and it is good to know its impact on lifestyle disorders. Now, how can healthcare professionals effectively integrate meditation into treatment plans for patients with chronic lifestyle disorders like hypertension and diabetes?
Right. So meditation is beneficial both for the patients as well as for the healthcare practitioners. It has been seen that the healthcare practitioners, those practitioners that are doing some meditation practices on themselves, there is a decreased incidence of burnout in those physicians also. That is empowering the physicians to work for the longer hours there. Then the overall health of the physician is also better. So we have seen that this consciousness that is always entangled either in doing something or into the mental and emotional. Freeing that consciousness and being aware of that consciousness is meditation. All right. So a simple tool like a breath awareness. You are just seeing how you are being breathed in this moment. Means you are not changing your breath in any way. You are just noticing that the breath is coming in, the breath is going out. You observe this breath for 2 or 3 breaths. The moment you align yourself with the breath, you notice some peace and calm that is surrounded you. So the fruit of meditation is not something that will happen in the future. The fruit of meditation happens here and now itself. So this is something that you can say is the well of energy that builds up energy in the system. The moment you align yourself, so what has brought this energy? The energy that was getting drained in the continuous mental stream. What does that mental stream means? A continuous threat, perceiving threat of the present moment, and making strategies either to fight or to run. That is something that is continuously draining you. The moment you are aligned with your breath, the present moment, you start conserving the energy, and your everything changes. You feel happiness, you feel peace. So this is a basic tool we can do, just simple breath awareness multiple times. So any meditation practices, whether it is bhakti, whether it is cognitive behavioral therapies, whether they are logics and all these things, what does that mean? They are the tools how you can declutter the consciousness wherever the consciousness is getting stuck. If they are getting stuck in the mental and emotional, you are working there in the form of logics, in the form of scripture studies and those things. If it is mainly, if you are someone who is having some alignment with feelings, then you move towards a bhakti yoga or something in which you are streamlining those thoughts and that energy into one channel. And something, if you are mainly someone who wants to work with the physical, then you are into yoga and those practices. So this is the basic outline how the meditation, different meditation practices your persons are choosing.
Yes, that was a powerful but calm example. Lastly, I would like to ask you one advice that you would give to healthcare professionals who are skeptical about benefits of meditation or are considering recommending it to their patients for the very first time.
All right. So first thing is that they should be explaining why this tool is important, because this is something that is one of the root causes for all the ailments. So if you say that functional medicine is a root cause resolution technique, so you need to first know where the root is. Root is not in the labs there. It is way deeper than what is there in the labs and in the investigations there. So aligning this, yeah, the moment the patient is into any of the meditation practice, that would be helping them in all the chronic ailments and everything. So this is something that they should know. They should be telling the patients the various studies that have been done on patients which tell that how these meditation techniques have helped in various ailments also. So this thing will be certainly helpful, and just giving a simple technique of breath awareness one would be good enough to start where you are, because until and unless your consciousness is disentangled from where it is presently, you will not be able to know what is working for you and what is not working. The moment this happens, patient will, whosoever is want to explore more about meditation, will be doing it. But basic breath awareness is something that we can all recommend to the patients, and we can practice it ourselves.
So before we conclude this session, I was very intrigued to know if you could share one example from your side of how meditation has actually helped in lifestyle disorders.
In most of the things, I was totally into addictions. All those addictions have gone because of meditation. I was a totally sort of hyperactive person with a lot of anxieties and those things. I have been through the various stages of my life where I've been in the very low stages, and there has been a lot of depression. Meditation has helped me to come out of everything. So there are multiple things.
Yes,
and then the daily dose of peace and joy you can only get from there.
Yes, thank you so much, Dr. Rahul, for sharing your invaluable insights and expertise with us today. It was a truly enlightening discussions.
Thank you for bringing me up here. Thank you.
Thank you. And to our listeners, thank you for tuning in. And remember, integrating holistic practices like meditation into our daily lives can have profound effects on our health and well being. So, practice meditation. And also remember, if you're a healthcare professional who is eager to delve deeper into medical topics or have questions, don't hesitate to join us on MedSynapse platform. MedSynapse platform is not just a resource, it's a dynamic space where you can connect with your medical peers, participate in meaningful discussions, and contribute to the ongoing evolution of healthcare. So until next time, stay healthy and practice the mindfulness.